Thank you for joining the Brain and Mind Experts, the podcast where we talk about the world's most advanced biomarkers and innovative treatments for cognitive disorders, including neurodevelopmental conditions, traumatic, and neurodegenerative disorders at all ages. Each episode, we will bring the latest news and information about how we can potentially help the more than 55 million people worldwide. I'm Tom Dent, Executive Chairman of Recognition Health. In 2011, Dr. MacSweeney and I saw this growing health crisis, and we wanted to be part of the solution. We believed we could assemble professionals, processes, and strategies to provide a specific diagnosis and then provide the newest treatment and care for people with cognitive impairment in both the United States and the United Kingdom. We recognized the phenomenal progress in research and development over the last decade, providing real hope to those suffering from these conditions. There's so much we can talk about, so let's see how far we can get in the next 15 minutes. Let's start today with a discussion on memory loss and specifically Alzheimer's. So today we're talking about a really fresh survey as of last week that was released by the Alzheimer's Association, surveying people's attitudes about early diagnosis, early testing, early treatment. 7 million people, it's reported, have Alzheimer's in America. I think that may be a low estimate, but regardless, we're going to explore how attitudes have changed and are changing, and we're just going to dive right in. Emer, welcome back. And the survey tells us 79% of the people surveyed actually want to know today that they have Alzheimer's, even before it's affecting their life events or affecting their family members. And that is a remarkable change from several years ago. It was not that long ago that people did not want to know. They said, don't tell me, I don't want to know. Let's have life just unfold. So what's caused this really pretty dramatic turnaround in people's attitudes?
Yeah, no, that's such a great question. And the reason I think really is threefold. So the first thing is that due to fantastic research and development over the last like 10, 15 years, we're now in a situation where it is possible to make an accurate and early diagnosis of Alzheimer's disease. And alongside that, there are now new medications which are designed to actually slow down or ideally halt progression of disease and symptoms, so long as detected very early. So there's two things. There's the biomarkers, which I think we're going to be talking about, which can identify accurately whether or not you have the disease pathology in your brain, and then the opportunity to access treatments. And this is both today in clinical trials and very recently also through treatments on the market. And the other thing I would say is that I do think generally people are increasingly focused and interested and concerned about their health, about longevity. And we also know through a lot of research that about somewhere between 35 and 45% of risk factors for Alzheimer's disease are what we call modifiable. So those are lifestyle factors such as exercise, diet, sleep, keeping your brain active, avoiding things that are bad for you. And knowing about these things and the biomarkers and the new treatments is completely changing the perspective of Alzheimer's disease.
Well, that makes sense. And the report says that researchers and physicians are very excited about what's called ATT's amyloid targeted therapies. That's a mouthful, which is basically referring to the two medications, Leqembi and Kisunla. But it also tells us that 91% of the people that were told about what's called blood biomarkers, and you mentioned it a moment ago, and we're going to talk about that, would be excited to take one of those tests. Now, there's continual confusion about the ever-evolving clinical terms, blood biomarkers. Can we just unpack this and let's talk about what is a blood biomarker? How do you take it? There's a whole series of questions here that I think all of us have. How long does it take? What's it mean? What's it tell you? So just jump into that, and I'll probably pile on with a few extra questions as you go along.
Okay. So what I'd like to do is actually just put the whole biomarker conversation in context, and particularly in context for Alzheimer's. So, a biomarker is essentially just an objective test that can either confirm conclusively or it can help to confirm the presence of a particular disease. And the thing that is invariably clever about biomarkers is that they will often either precede um, or be detectable when symptoms are extremely mild. And for doctors with any disease, it's very difficult to confirm a diagnosis if you're just trying to go on symptoms. So take diabetes or hypertension. But if you think of diabetes, you don't wait till somebody's got severe problems with their limbs before you make a diagnosis of diabetes. You measure their blood sugar, so that's a blood biomarker, or you measure something called HbA1c. That's also a blood biomarker. Now, with Alzheimer's disease, the problem is that it develops very, very slowly with symptoms of our sort of thinking ability. So you get mild cognitive impairment. And it's impossible when symptoms are very mild to determine what that mild cognitive impairment is due to. Is it due to the very, very early stages of Alzheimer's, or is it due to just maybe low mood? Is it due to thyroid function dysfunction? There's just lots of different causes for that. So what we need is we need biomarkers that will tell us accurately early on, when it's possible to access these new treatments, early on, whether or not this is the beginning of Alzheimer's disease. So there are actually quite a few biomarkers already for Alzheimer's disease. We have a PET amyloid scan, which will tell us if there's elevated amyloid protein in the brain, which is the hallmark for Alzheimer's, which we can talk about as we go through the podcast. We can also do a spinal fluid tap and look at the CSF, the spinal fluid, and that will tell us we have abnormal amyloid or tau, the other key protein in Alzheimer's disease. But now there is a new blood biomarker. So this is a blood test, and it measures something called p-tau 217. So that's phosphorylate tau 217, and that measurement of p-tau 217 correlates with accumulation of amyloid protein in the brain. And in fact, they're increasingly sophisticated blood biomarker tests now, which combine also measuring different types of amyloid A beta 40, 42, and those results combined with the p-tau 217 result can actually give a very highly sensitive and specific indicator of whether the mild cognitive symptoms that you're experiencing are due to the progression of abnormal pathology in the brain, abnormal buildup of these amyloid and tau proteins in the brain, which in turn then provide the diagnosis that those symptoms are due to the very early stages of Alzheimer's disease.
All right, now let me just go back. So you mentioned three different types of biomarkers. The last one, the blood biomarker. How do you know which one to get? Which one is better? And then I want to know, should I just run out? Everybody just run out and go get a blood biomarker or get a just tell tell us when do we know to get one, and which of those three do we want to get?
Yeah. So no, understandable. So, um, I mean, to be honest, like other biomarkers, the most appropriate thing in medicine is don't do a test unless you know what you're going to do with the answer. And I think that's a fairly ubiquitous piece of advice. Um, if you if today you are concerned that you have problems with your cognition. Now, that's always a difficult thing to define. So, I'm going to say if you're worried that you are developing problems with your short term memory, you're forgetting details of recent events, you're forgetting details of recent conversations, you're having to make more lists, you're asking the same question within 5 minutes of last asking it,
So
or
this
you're
isn't something you would. Can I just add, this isn't something you would do as an annual health checkup. This is when you have a concern that is more than just the general concern that we
yeah,
all have occasionally when we
yeah.
lose our car keys.
Yes, yeah. This and I would maintain, having talked to so many people with early stage of Alzheimer's disease, people know when there's something wrong. So later in the disease, people do actually lose insight. But early on in the disease, when mild cognitive symptoms present, people tend to know. So it's also having difficulties. There's various different cognitive domains. So one is short-term memory, one is language. People start using more generic words instead of specific words. So they might say, referring to their computer mouse, they might say, "Oh, where's the thingy?" So they they don't use specific vocabulary, and their vocabulary starts to shrink. The other thing is a facility with numbers. They just notice that it's a little bit more difficult managing numbers than they experienced previously. They may notice a little bit of difficulty with what we call visuospatial. So getting a little bit lost in a familiar environment, forgetting, do I go this way or do I go that way? Again, it's if you've experienced it, you'll know what I'm talking about. And then the other sort of like big package is what you call sort of like thinking ability. So it's planning, it's decision making, it's sequencing things. And then finally, one of the very early presentations often is that people have an inexplicable level of anxiety about something that they would not previously have experienced any specific anxiety about. And very often, this is just sort of like detected as or diagnosed as maybe it's just sort of like early low mood or depression or someone's just stressed. So it's very important to take these symptoms seriously. And the reason I say that is because today that is the sort of scenario where certainly if you are talking to your primary care physician, or maybe even talking to a neurologist, if you're just doing a normal cognitive assessment, that may not be sufficiently sensitive to pick up these relatively subtle cognitive changes. Now, the p-tau217 test specifically, I'm not 100% sure like how readily available it is to each primary care office, etc. But certainly, if you are worried, you should certainly talk to your primary care physician, and they will know, or they should know, and you can Google, you can see where are centres that focus specifically on Alzheimer's disease. And you will probably find, I mean, a bit, to be honest, like our centres, where we also undertake clinical trials, those centres will definitely know exactly how to assess you, not just by asking cognitive questions, etc., but actually to look into undertaking these biomarkers. And I do want to say that there is actually a pathway in terms of you don't just suddenly rush off and do a blood biomarker. You actually go through a pathway of sensible assessments because it's very important to also exclude other causes of these cognitive symptoms.
So I just want to ask, what is the accuracy of this test? And I'm assuming there are ranges of normal and ranges that are abnormal that are pretty clear and cleanly cut. But is it accurate?
Yeah. That's a really good question. So the answer is, at this current time, if your p-tau217 value is high, like in the high range, then that has a very high, so like over 90% sensitivity and specificity. So it's equivalent to doing a spinal tap and a CSF analysis, spinal fluid analysis. If it's very low, similarly, that is very sensitive and specific for not having any significant accumulation of toxic amyloid protein in the brain. If it's in the intermediate range, and there's about a 20% intermediate range, and in that intermediate range, then it's equivocal, and in order to get a higher level of certainty, then you would need to have either a CSF analysis or a PET amyloid scan to see whether or not they're able to detect abnormally elevated levels of amyloid protein in the brain using those techniques.
And just to confirm, Recognition Health does provide all of those biomarker tests for anybody.
Yeah, and actually, I think this might be a good time to mention. I think it's so important to constantly keep all of this in perspective. Um, so currently at Recognition Health and other centers where also they do clinical trials, you can have all of these tests done in the process of screening for a clinical trial which is for one of these new disease-modifying medications to slow down or ideally halt progression of symptoms. Or you can also, as a private Medicare insured patient, if you are interested to have the appropriate tests done, which includes the PET scan and MRI and everything else, you can have those tests done to see if you are eligible to receive one of the new treatments on the market. So these new treatments on the market are Kisunla, also called donanemab, which is an Eli Lilly medication, or Leqembi, which is also called lecanemab, which is an Eisai medication. And we at Recognition Health have actually been giving these medications in clinical trial to a huge number of people, both in the UK and in the US, where we have clinics, since, well, so like over the last, sort of like, I don't know, sort of 4 or 5 years. And in fact, we have given over 10,000 intravenous treatments of this class of medication. So our teams are extremely familiar with the screening testing that's required to see whether or not you have biomarker proven evidence of Alzheimer's disease as the cause of your early cognitive symptoms, um, or whether it could be due to something else. And I do want to emphasize, it's like knowledge is power. And if you're worried about these symptoms, it is very important today to get a diagnosis. One, because it's possible, and two, because there are treatment options, either these medications that have just come onto the market or other new medications that are in clinical trials still, which are also designed to slow down or ideally eventually halt progression of Alzheimer's.
And I'm assuming anybody interested can go to thebrainandmindexpert.com, get more information, or even call one of
Yes.
Recognition Health Centers
Yeah.
for sure.
We have a team of people who work pretty much 24/7 because they are talking to people in the UK as well as in the US, and they will be able to talk to you about exactly, what is, and it is a little bit bespoke to the individual about what is the right thing for the individual to do.
And I think I heard you say, but I just want to be clear, whether you're interested in a clinical trial or one of these new therapies, a blood biomarker or some form of biomarker will be required and is um,
Yeah.
given. Is that correct?
Yes, it's, I mean, at the very late stage of Alzheimer's disease, um, there's a, you know, anyone, but particularly a doctor, will be able to make a relatively accurate diagnosis that those advanced cognitive symptoms are due to Alzheimer's disease. And to be fair, that is largely because Alzheimer's disease is a pandemic, and it is the single most common cause of cognitive decline, particularly as we all get older. So, almost by default, they will make the diagnosis, the correct diagnosis. But in the early stages of the disease, it is very difficult to make an accurate diagnosis of Alzheimer's disease just by doing cognitive assessments. It is essential to have these biomarker tests.
So, one of the I think, general concerns and issues that I hear mentioned is that a person has a memory concern, they go see their primary care physician, and many don't have primary care physicians in America today, or they go to a neurologist and they leave not having clarity about what their issues are. And oftentimes, I'm told clinical trials are not mentioned as an option, and even more recently, some of these medications aren't particularly mentioned or identified. So, how equipped is the general primary care physician and the general neurological practice equipped to actually give patients proper assessment and guidance and advice? And I know that's kind of a loaded question,
Yeah.
perhaps.
I'm actually, to be honest, I'm going to answer that question on almost like a global basis because this isn't an American problem. This is global. It's the same in the UK. Recently, I was in Middle East. It's the same there. The issue, which is good news, is that the rate of R&D and the rate of development of this new era of biomarkers for diagnosis and new era of disease-modifying treatments for Alzheimer's disease has literally sort of come across us or come upon us very, very quickly. Now, that is great news for all of us, but there is an issue in so much as that globally, there really, it's a pandemic, and there are not enough primary care physicians or neurologists who have had the opportunity to be able to both sort of like keep up with the most recent research, and also to actually see the volume of people who are affected by this condition. And particularly as we now want to find the people who have very early symptoms, because they're the people specifically with in the context of biomarkers and new treatments that we can make a difference for. Um, that number is enormous. And so I think the one thing that I would say to everybody is, if you are worried or you're worried about a friend or a relative, you really do need to take agency and control, if you like, and for your own destiny. And I would strongly encourage people to seek out experts in this field. And the reason I'm emphasizing this sort of like time is of the essence, is because for the new treatments, and this is across the whole broad trials or on the market, there is actually only a relatively small window of time when you can benefit from these treatments. So that is when you have either mild cognitive impairment, which is not a nebulous term, it actually refers to a situation where you are aware that you definitely have problems. You have to maybe make extra lists and sort of like have extra reminders and things, but you can still manage your life and your daily activities independently. Then the next phase is something called mild AD dementia. And in that phase, you still are enjoying everything, doing everything, but you do need some help. You need someone to help you with various tasks. Now, these medications are only licensed and only effective for people who have mild cognitive impairment and mild AD dementia. If you're before that stage, you're normal. We can talk about that in a minute. No. If you progress beyond that point where you have moderate AD dementia, then these drugs are not effective and they're not licensed. So the rate of progression of disease and symptoms in Alzheimer's increases with time. And this is because of the way the protein called tau spreads around the brain. It spreads from one brain cell to the next. And the rate at which it gets into more and more brain cells and destroys those brain cells increases with time. So there is a relatively short period when you're aware of cognitive symptoms during which you can benefit from these treatments. And that is why when people say, oh no, I think, and this is the other big myth, people say, oh no, I think it's just normal. I'm like getting a bit older, so, and I've just retired, so this is normal. No, it's not normal. It is not normal to start you losing your memory as you get older and to not be able to think properly. So if you're experiencing those things, you need to act quickly, because today, and the wonderful thing in the US is this, and I won't go into all the details, but talk to your insurance company, and particularly if you have Medicare insurance, because the US is covering a large part, if not all, of this treatment. So, and the clinical trials, there's lots of clinical trials that are taking place in our centers and other centers in the US. It's literally there for you. All you have to do is to almost like go on the internet, find out centers where they're doing this, and contact them. And it's up to you to do that. And I would say the biggest secret in all of this is early action. And the most common thing that patients say to me, and I have hundreds of patients who've said this to me, is, I wish I'd known about all this earlier. I wish I had done something about this earlier. I wish my doctor had investigated me much more proactively when my symptoms were very mild and I knew there was something wrong.
What do I do if I'm, uh, yeah, what do I
Yeah.
do? Who do I call? Where do I go? Because I'm lost with
Yeah.
PCPs and
Yeah.
neurologists, and I want to go to an expert that can properly put me either on a clinical trial or put me on medication or both.
The answer is, quite specifically, if you're actually anywhere within the DMV area, we have a center in Fairfax. if you're in Chicago, if you're in Fort Worth, anywhere in the whole Dallas area, if you're in Houston and the surrounding areas, we have centers in those areas. And quite specifically, if you call Contact Recognition Health, we have people who'll be able to talk to you pretty much 24/7, and they will be able to advise and determine a pathway for you at one of our centers to either way to get a diagnosis, but then to either, and this is choice and eligibility criteria, to either have treatment on the market with Kisunla or Leqembi, or to screen into a clinical trial. And that sort of like choice is a number of factors, but will ultimately be a combination of eligibility and your choice.
I do want to mention we have England covered. We've got sites up and down England, and anybody that maybe is in Europe or in the UK on a permanent or part-time basis, there are a handful of centers there that can do the same thing.
Yeah, and actually, I should have mentioned that. Thank you, Tom. I mean, in fact, in our centre in London, in the UK, we have people coming to us from all over Europe. So, you know, this is a big catchment area for this particular condition. So we have people from Greece, Italy, Germany, I don't know, Finland, Denmark, everywhere, as well as all of the UK. But we also, if you are listening from the UK, we have centres in Bristol, Guildford, Winchester, Plymouth, and Birmingham.
And I think you were the first to administer one of these medications in all of Europe. Is that correct?
Yeah. We administered the first Kisunla medication in the whole of Europe, and in fact, the individual who received that treatment also lives in the Middle East, and in fact is having their treatment there with an affiliate of ours, and in fact will be having treatment in one of our US centers later this month. So that's the other thing, is if you do travel around quite a bit, we can also, as a company, we have about 75 clinical experts, physicians, plus an entire team that work on this type of treatment, and we can provide treatment for you in any of those locations.
So actually, that's a good bridge to maybe the last couple questions I have. Just, I think there's an element of confusion as I even listen to this. How do I know if I call Recognition Health or any specialty center, do I want to get on a clinical trial? Do I want to get on these therapies? How do I sort that out? Or do I leave that to the professionals to tell me? Because I think that is a question that everybody has. Which route do I take? And how do I know?
Yeah. So I think at a sort of like sensible level that I can discuss in 2 minutes, the answer is there are specific eligibility criteria that determine which would be the best or permissible treatment for you. Um, and so ultimately, it may be that you're eligible for treatment on the market, so Kisunla Leqembi, and you're also eligible to join some of the clinical trials, one or two or more of the clinical trials. You can only join one at a time, obviously. And those eligibility criteria are, they're clinical criteria. And so it may be that you're in the fortunate position that you could do either, and in which case it's your choice. If you're in a position where you're not eligible for a trial, but you are eligible for treatment on the market, and you want to go that route or that route, then that's your choice. That's the way to go. If, on the other hand, for some reason you're not eligible for the treatment on the market for some other condition, or you might be, for example, if you're on blood thinners, you won't be eligible for the treatment on the market, but you may well be eligible for a clinical trial. And in that case, then if you'd like to, you can choose to screen and to go on to a clinical trial.
So the report, as we kind of try to wrap up here, said 66, I think, percent of people were believing we'd have a vaccine very quickly that would eliminate the need uh, for worrying about Alzheimer's, not unlike polio, which has been basically eradicated. Is a vaccine on the near horizon, and should people be waiting for that before they take other kind of actions?
That's also like a really good question. So the answer is that Alzheimer's disease is no different from any other disease. And actually, it's a great disease to treat because the abnormal disease pathology starts about 20 years before you develop your very first symptom. So there's a massive time when people can actually undertake preventative actions. Today, there is no preventative treatment that is on the market. However, yes, at our recognition health centres, we're doing a number of clinical trials which are actually for preventative treatment. So as it happens, and obviously you'd have to check on our website for the various different sites, but we are actually currently undertaking clinical trials for people who are completely cognitively normal, as much as any of us are, um, and those individuals are assessed to see in the clinical trial if they have abnormally elevated biomarkers. And yes, it includes p-tau 217. And if they have high biomarkers, so in other words, they haven't got any symptoms, but they are at very high risk of potentially developing symptoms, then they can come into a clinical trial. And in that clinical trial, you'll be randomized. That means that by big computer, you're sort of like randomly distributed to either taking active medication or placebo. And we and you won't know which group you're in. But amongst the treatments are vaccines against Alzheimer's disease.
We're in an exciting, very exciting period of research time in this disease, no doubt. So as we finish up, it may be too early. There may be limitations to what you can say, but have you seen any evidence of improvement in memory by any of these patients that are on these medications or some of these trials? Is there any positive, exciting evidence, or is it just too soon?
So I have to obviously sort of like clinically be cautious in how I answer that. So the first thing is that for the two medications on the market, the data is that they slow down further progression of disease and symptoms. Um, we obviously have lots of patients who are on clinical trials with us as well, who are on medications where there is a combination of expectation that it will both slow and boost cognitive symptoms. But what I would say, and I think, anybody who would ever speak to any of our patients would confirm this, and we actually do objective tests, so like just cognitive tests to assess this, is that people who are really worried and anxious that they've got Alzheimer's disease and they don't know, it takes a massive toll on them physically, emotionally, mentally, in every way. Just like worrying about whether you've got cancer or not. When people get a diagnosis and they start on a treatment, either in a trial or now on the market, it's a massive relief for them and for the family. And I think, as we all know, if we're stressed or nervous or anxious, our cognition is adversely affected. I mean, the ultimate is sort of like stage fright. So we do see, without question, that people are more relaxed. They sort of like actually just sort of like function better and enjoy life more once they know that they've got a diagnosis and they are doing something which they know is a proactive, positive response to the disease that they have. And I'll give you one little example. This is literally just last week. I have a patient who she is a doctor and her husband is a doctor. So they have, they know the results of the studies. They're not under any illusions as to, oh, the treatment might be magic and do this or do that. They understand everything. And they came back to me. They've been on the treatment. They've been on the Axilla treatment for like a few months, and they came back and they said, we don't know what's going on, but it's his wife who feels so much better. And in fact, she'd cancelled going to a big family wedding, and she'd cancelled going to her big medical school reunion because she just couldn't face people and didn't want to go and thought she wouldn't be able to have conversations and things. And she said, you know what, I put both of those appointments back on my schedule and I'm going to both of them this summer and I'm really looking forward to them. And I said, oh, great.
Yeah, that is so good. Emer, thank you so much. I always learn more and more every time I talk to you. I know that anybody interested can go to our website, thebrainandmindexpert.com. There's a full list of trials that we're offering. There's information about these treatments. You can call that center. Our team will be happy to make an appointment and arrange all of that for you. And we're going to close, and we've been talking with Dr. Emer MacSweeney, a global expert on this subject. And it's so fascinating to hear all that's going on in Alzheimer's research. Thank you.
Thank you. Has this conversation left you wanting more information? Are you wondering what are the early signs of Alzheimer's? You and family members can take a quick test by going to thebrainandmindexperts.com.